So a lot of times when people think about their hormones, they're thinking about in terms of not having hot flashes, not having night sweats. Sometimes they think about their hair and skin. But did you know this? That your hormones play a very important role in your eye health and in your vision. And when you're in menopause and perimenopause and your hormones start to drop, that's the same time that your eye health and vision will also start to reduce.
Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates, brought to you by PerimentalBliss.com, and today I want to talk about the role that your hormones play with your eye health and vision. Obviously, those two go hand in hand, but just so we put them all together. Eye health and vision, okay? So, there's so much things that your eyes require. The amount of blood that your eyes require versus the size of those organs is huge. The amount of antioxidants that they require is huge. They are a very demanding small organ, and they link directly with the brain. But hormones also play a role with this organ. So let's talk about that. I'm going to talk about 5 key eye conditions where when your hormones drop, they can play a role with this, which is why balancing your hormones and maintaining some sort of hormone balance is critical. Let's get into it. Number 1, a very common concern, dry eyes. So estrogen can actually play a role in your tears and the viscosity of your tear. So as your estrogen levels drop, the quality of your tears decreases, which means more dry eyes. And this is common. This is something you definitely see increase with age, especially when you're getting into perimenopause and menopause. You will see a lot more people complaining of dry eyes. Now, other factors to be aware of. I want to go through a few other things for each point that can play a role. And I'm going to do another podcast, maybe the next podcast, on natural remedies that can play a role in eye health as well. But keep in mind, if the eye health, if you're getting a lot of problems with dry eyes, take care of the hormone balance, but then you got to go through if you're on a bunch of medications, you have to review those medications because a lot of those can cause dry eyes as well. Number 2, macular health and macular degeneration. So at the back of your eye, you have where your retina is. In the center of that, there's a little spot called your macula. If this area gets damaged, we're talking major problems with vision loss and sometimes things that are not corrective. So you need to focus on prevention, which means hormone balance for macula health is really, really, really key. Your estrogen plays a protective role in the macula. So as those levels drop off, you can see how that can lead to macular degeneration. Now, other things, let's talk about that. Some other things that play a role with your macula. You need to make sure you're getting high levels of antioxidants into your system. And then anything that could from trauma to the eye. So those would be 3 major things. But for today, Perimental Bliss Podcast, we're talking about the role of estrogen with macular degeneration. Okay, so it plays a role. Number 3, your optic nerve. They have found estrogen receptors on the optic nerve, suggesting that estrogen plays a role in the health of your optic nerve. Otherwise, your body wouldn't bother putting receptors on there. The next thing is that the myelin, this is like fatty sheath that surround the nerves. Progesterone plays a role with that. So estrogen with the roll itself, progesterone with the sheath supporting the outside of the nerve. These factors are critical for the health of the optic nerve. No optic nerve health, no eye health, no vision at all. Because all of the information coming in from the light through your lens, hitting your retina, is being transferred through the optic nerve to your brain. So we have to take care of the optic nerve, which means you have to take care of your hormones. Number 4, Generalized eye pain, so burning, itching, painful, more raw eyes. Studies have suggested that estrogen can play a role with this too. This kind of ties into point number 1. Like if you have more dry eyes, more irritation, all of that can be affected from your hormones. So eye pain, that especially if it's starting perimenopause, menopause, consider the hormones. And number 5, this is a big one, glaucoma. Glaucoma. So the fluid inside your eye, it needs to be coming in and it needs to drain. And when you have difficulty with the draining, or if whether it's because there's a problem with the duct that it's draining out of, or if the fluid's getting too thick, this can lead to an increased pressure within the eye. And this pressure can lead to severe pain and blindness. So this is called glaucoma. Estrogen and progesterone have both been shown a role in improving the flow and reducing the pressure. And what has been shown is that the levels of glaucoma that happen post-menopause versus before menopause, there's a sharp increase in those rates. Okay, so as people go into menopause, their risk for glaucoma increases, which strongly suggests the role of hormones in the prevention of glaucoma. Would that be the only thing playing a role? Not likely. And when it comes to health, there's never usually one thing. But it suggests that it plays a role, so it's something that you should be addressing. So, if you were wondering about eye health, and if you're in perimenopause or menopause, if you have any concerns with dry eyes, macular health, optic nerve health, eye pain, or glaucoma, please consider getting your hormones balanced. And we're going to go into the next podcast and we're going to discuss more things that you can do to improve the health of your eyes. I hope this was helpful. A nice quick one today. This is Doc Yates, and I am signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit paramenobliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.